First of all, I want to commend the organizers of this event, starting with the COG, our development partners, our host, Homa Bay County, for convening this dialogue, the one that goes to the very heart of our equity, inclusion, social justice, and protection of our children. Because, you know, our children's rights is enshrined in our Constitution. And one of the rights is right to health. And when you talk of matters of nutrition, we are talking about promoting the rights of children when it comes to health. I want to talk about the mandate of the State Department of Children's Services, because this is a new State Department of Children, a new department that was created sometimes back in April. And the reason for creating this department, His Excellency the President has, with great concern, noted that children account for 46% of the population of Kenya, and therefore giving them the attention that they deserve gives this population a chance to advance their rights that are already enshrined in the Constitution. 10% of these children are underweight and 5% are wasted. We also have a challenge of overweight children. About 3% of these children are overweight. When it comes to breastfeeding, recently you saw a report about 40% of children are not being underfed. These are infants that are under 6 months. Exclusive breastfeeding among mothers has gone down. This could be because these mothers are engaged elsewhere in employment and do not have a chance to breastfeed the children. And that is why you see the mandate of the State Department has been extended to promote workplace lactation.
Good nutrition is a pillar or is the foundation for health, productivity, and economic prosperity. If we don't get it right, we are not going to grow as a country. We are saying it's a smart investment. For any dollar that is invested in nutrition, it yields $22. For those who are biashara, if you do that math, really, that's why at the county level, we have to invest in returns. But we are saying it's also a human right. It is embedded in our Constitution, the right to nutrition. Why should 18 children in 100 be stunted in a country like ours? That's very bad in terms of meaning that we are not investing in our children. We are looking at 43% of our adolescent boys are too thin. Where are these adolescent boys? Most probably in boarding school. What are they eating? I think we have, more than almost close to half of the boys. We need to do something because it means even in terms of their strength, whether from the physical or from the reproductive, it will be affected. Imagine nearly half of us, 45% of women, we are overweight and obese. What that means, that 45% are at high risk of getting non-communicable diseases. Yet another burden in the healthcare. We can prevent it through good nutrition. The economic losses in terms of child nutrition is really huge. With the National Treasury, we did the cost of hunger in Africa, Kenya study in 2019. And what we realized is that as a country, we are losing 373.9 billion shillings, almost 7% of our gross domestic product due to child nutrition. And these costs are related to health, they are related to education, and also they are related to productivity. At that time, we were informed that 374 billion was more than the allocation that the 47 counties got that year. Imagine what a loss.
We have 42% of adolescent boys very thin, but we have over 40% of our mothers overweight. And then we have 18% of our children stunted and undernourished. What kind of situation is this? Chakula bora ama bora chakula?
One of the key determinants is we have what we call the immediate determinants or the causes. And under this, we basically look at what diets are we feeding our children and women on, and actually our men, because if they don't get zinc, then clearly things are going to go astray. Then the other key area that we look at is what we call the underlying determinants or the causes. Here, are we having children being fed on appropriate foods for their age, and also for, if it is the adults, for the jobs that they do? Are we also having good practices being done for our children? And when I say good practices, it means, are we breastfeeding our children as we ought to for the first 2 years? I think one speaker, our MC, asked how many were breastfed for 2 years, and there was very few numbers in the room. So we need to be in a space where that is being done very well.
The government is not financing enough when it comes to nutrition, and this has been mentioned. High dependence on our partners, which is a good thing, but again, the country ought to support, child nutrition and all that. So we are not really short of our plans. Another thing is that the issue of the multi-sectoral coordination is a bit weak, and we need to see how we can do that when it comes to nutrition.
Honorable Kizito, my question to you is, to what extent have counties contextualized, prioritized nutrition in their strategic planning documents?
I have not asked the governors to have a conversation on nutrition. If I'm wrong, governor is here, you'll confirm. As the Council of Governors, we have never. Have we had a discussion with the Cabinet Secretary in charge of health on matters nutrition? We haven't. That's a huge gap. Because if the leadership is not taking lead, who is responsible for giving direction? So we may have those synapses there. But the top leadership needs to drive the agenda. And we would need to fast track, as we sit, a dedicated conversation between the Cabinet Secretary in charge of health, the Cabinet Secretary in charge of Children's Affairs, and the Council of Governors on matters nutrition.
There's a lot of advocacy involved, because for you to be able to convince the political team that they need to invest in nutrition, you need to tell them why. And I think we've done a lot of advocacy with MCAs for us to be able to convince them they need actually to invest in nutrition. And we've seen a lot of transparency and accountability through the process, because we are using government systems. We are not using any parallel system. They are able to do their own accountability. They are able to use their own procurement processes. We ensure that the funds is put in the special purpose account, whereby the county is able to put in their money and we match.
The sad news is that in Kenya, only 37% or 36% of our children are accessing 3 food groups and above, meaning that 63% of our children are actually experiencing child food poverty, which is really a pity, considering that we have counties that can really produce good food under this. So to address that gap, within UNICEF, we are promoting what we are calling the Fast Foods Africa initiative, which is one of the efforts to ensure that we are strengthening the food systems for children, working with the private sector to ensure that they are producing readily available and affordable nutritious foods for our children. Yes, let me stop at that.
Nutrition is the foundation of a healthy and wealthy nation. Without proper nourishment, our dreams of industrialization, innovation, and prosperity And all those other flowery things that we talk about day in, day out will just remain dreams. When our children are stunted, our mothers are anemic, and our people are increasingly affected by preventable diet-related diseases. And when we look at the statistics, they are very clear, because the KDHS of 2022 informed us that 18% of our children under 5 are stunted. 45% of women of reproductive age are overweight or obese, and 43% of adolescent boys are thin. Is there something like that in nutrition? They are thin. Yeah, we are thin. Yeah. The other thing is that this is compounded by micronutrient deficiencies. We are talking about iron, zinc, iodine, vitamin A, and folate, which weaken our immunity, reduce productivity, and increase healthcare costs. When we nourish our people, we nourish our economy. When we invest in nutrition, we invest in justice, equity, and prosperity. This is how we will build the Kenya we dream of: a healthy nation, a wealthy nation, and a great nation. Asanteni sana. I think at this juncture, then I will take this opportunity to actually declare this meeting closed. Thank you very much, Mr. Speaker.